has your doctor mentioned anything about how long you're going to be on the maintenance therapy,
It was
and
a
how they're going to make the decision about should you can continue on it or when to stop?
And so it was we had a really good conversation on that. And the notion typically around maintenance for something like this might have been 1 year, maybe 2 years. As we were reading through the clinical studies, we really couldn't find anything other than the fact that all of the clinical trial patients were basically on it for the duration of the clinical trial. And the trial was up to 7 years long. And so with this coming on and with the not being able to get any clear answers, we decided, well, we'll stay on it for the time being and let's see, maybe it might even be up to 5 years, it might even be longer. And as Bristol Myers Squibbs gets more information and more usage out of this, we might be able to get a better answer 1 or 2 or 3 or 4 years down the road to determine how long we need to be on this.